Where are we in terms of cure hunting relative to the work that's being done at Merck?
Well, my philosophy is that science always advances, and that what seems impossible one day becomes routine the next. And particularly as we really understand more and more about where HIV hides in the body and the molecular mechanisms which control HIV in this persistent latent state, it really opens up possibilities that we can test to see whether or not any of these sorts of interventions can ultimately lead to eradication and perhaps even cure people of HIV infection. But you don't know if you don't try.
Now, people talk about an eradication cure, and they also talk about a functional cure. So what does a functional cure look like?
A functional cure would, in principle, be composed of a mechanism whereby HIV still exists in the body, but exists in a state where the immune system can actually control it. And so you don't have the need to have antiretroviral therapy, and you can take people off of therapy, but the virus will still remain in a dormant state.
And people won't be infectious.
And it won't be infectious.
Right. Can you talk a little bit about the importance of having scientists work together and also how unusual these collaborations are?
Yeah, so several years ago, we met with the NIH Division of AIDS and several academic investigators, including David Margolis, who really was the one who spearheaded this meeting. And we all came to the conclusion very quickly that although many of us were doing independent research on different curative strategies, that it was such a very large problem that no one academic scientist or no one individual scientist in a company could really move the research agenda along in a way that was rapid enough without some concerted collaborative effort. And so as a result of that, the Division of AIDS recognized that this was a very large problem requiring a large amount of academic and industry collaboration, and so they funded two large collaborative initiatives, one led by UCSF and the other by UNC, and Merck is the pharmaceutical partner in both of these academic collaborations.
And what does that mean to be the pharmaceutical partner? Are you donating drugs? Are you overseeing the process? How does it work?
Well, we provide, I think as a pharmaceutical company, pharmaceutical scientists have a particular expertise that I think is very unique and different from the expertise that academic scientists bring to the table. So really understanding things like pharmacology, pharmacokinetics, I think is really a very integral part of both of these research agendas, where we're trying to test whether or not particular interventions will work in either boosting the immune system or flushing out the hidden sleeping virus in the latently infected cells. One of the, I think, critical elements of both of these collaborations is the development of new animal models and testing these interventions. And so having the expertise of pharmaceutical scientists is really critical to making sure that these experiments are designed appropriately.
I get asked all the time, can we cure it, and can we cure it in our lifetimes?
Can we cure HIV? Well, I wouldn't be working on eradication research if I didn't think it was possible. Whether it's possible in my lifetime, I don't know. But as I said, science always advances, and you won't know unless you keep trying.